We are in a desperate health crisis because of the COVID-19 pandemic. People are getting extremely ill, they're dying, and we do not have effective medicines or vaccination or other treatments that will significantly change the course of this illness.
So Seattle has been at the epicenter of the COVID-19 outbreak, and because of that, we have patients who were diagnosed earlier than anywhere else in the country.
So convalescent plasma therapy is a technique whereby someone who has had an infection with a pathogen, it could be virus, it could be bacteria, in this case it's the coronavirus, has recovered and their immune system develops antibodies to that pathogen.
Convalescent plasma is used for multiple purposes. The first purpose is for treatment of severely infected patients. These are patients who are acutely suffering from COVID-19.
So this is a process whereby a donor, someone like myself, who has had the disease, gives their plasma, and that plasma is tested to see whether or not it has those antibodies against the virus, and then that plasma is infused into a patient who has the disease and is currently suffering and not really coming out of it and not able to recover on their own.
So the whole idea of the therapy is that people who have recovered from COVID-19 have abundant amounts of those antibodies in their systems. And by taking their blood, we can use their blood to help other patients get better faster.
We know that they worked for tetanus in 1890, for example. We know that they worked for the H1N1 flu when we had that epidemic. Now we really need to know if this works well for COVID, and if it does, we need to maximize the positive effects.
The second treatment that we're looking into, and we're doing this in partnership with several collaborators, is to take those antibodies from survivors' blood, purify them, and then they're used for a therapy called intravenous immunoglobulin therapy, or IVIG. So this is a more purified form of the transfusion product, essentially. That work will go through clinical trials, and we'll see how efficacious it is. It also gives us the opportunity to collect specific antibodies and to determine which antibodies are the best at helping people recover. This is an experimental treatment, so we're going to collect data along the way to ensure that this is really helping patients to the extent that we've seen in China. The BloodWorks Northwest Research Institute has been in existence for decades, and we have some of the premier blood scientists working at our institution. We're working with the University of Washington and other local and national hospitals. We're also working with federal agencies, and particularly agencies within the National Institutes of Health.
Our program is looking for people who had the COVID-19 disease and recovered and have been symptom-free for 28 days. If you are healthy enough to be a blood donor and you're fully recovered for the 28 days, we would like to hear from you.
Well, I think it's simple. I have the potential to save someone else's life, and by coming in and doing something that's minimally invasive to me, only requires about an hour and a half of my time, because my immune system was able to fight it off on its own. And so why wouldn't I give that gift to someone else? It would be selfish not to do that.